You have a patient in your outpatient department, or even you are basically focusing on a patient who is currently having a seizure, and the relatives or the primary caregivers have brought him to the emergency department. How are you going to go about and manage this particular case of epilepsy is again very important. First of all, you're going to start off with stabilizing the patient. So that is the primary focus when a person is having a seizure. That is the primary focus, to stabilize the patient. The ABC, that is the airway, breathing and circulation of the patient, is stabilized at the foremost or at the uttermost in the emergency departments. Then once the patient is stabilized, you're going to start off with the history taking in the detailed manner. First of all, coming up with the particulars of the patient, and obviously the sex, the age, all of these factors have their important or significant roles in the history taking. And then we'll move on to the presenting complaints, whether there was an aura observed in that individual, whether it is the first episode or it is a repeated episode of seizure that is observed in this particular person. It is whether it is a case of a single seizure or it is a case of a repeated seizure activity in that individual is also very significant while you're taking the history in these individuals. Then you're going to move about towards the investigations in these individuals as well. Another points of the history taking that are quite significant are the past medical or the surgical history, whether the patient is suffering from some sorts of medical conditions, whether he or she has the history of a recent head trauma in the past is also very important. As I've already emphasized, there are conditions which are known as the post-concussion syndrome, and that are quite similar to the epileptic seizures. So one should know how to distinguish or differentiate between these two clinical pictures, whether it is a case of a post-concussion syndrome or whether it is a case of the epilepsy. So knowing this and knowing the differentiation points between these two syndromes is again very important. The differential diagnosis has to be quite clear in the mind of the person as a clinical physician, even if you're practicing psychiatrist, you should know how to differentiate between these two conditions. So once you have taken the past medical and surgical history, you're going to move on to the personal history of the patient. Then the drug history of the patient. Obviously, is there any history of substance misuse or alcohol withdrawal syndrome? All of these are again the significant points or the features which distinguish the cases between the epilepsies or the people who are having the seizures due to some other causes. So this is basically how do you go about and take the history taking in this particular person. The allergic reactions are also noted down in these individuals. The investigations have to be carried out for any sorts of medical conditions that can relate to this type of a seizure in these individuals. Again, the investigations are going to sort out the metabolic disorders in these individuals as well. So these are the basic treatment guidelines in these individuals that one has to keep in their mind just to sort the disease of epilepsy more rhythmically or more in a step-by-step manner. The anti-epileptic medications, the knowledge of the anti-epileptic medications is again very important. So we'll be discussing that over here. Once you have diagnosed the case to be of particular epilepsy or a typical case of epilepsy, you should know what are the range of drugs that you have that you can choose from. So the surgical treatments are also devised and they are sometimes coupled up with the medical interventions to have a better outcome, to have a better prognosis in these individuals. Then we have the vagus nerve stimulation that is sometimes done in these patients who are suffering from the epilepsy. So we can also consider that over here in this treatment guidelines that are related to the epilepsy. The anti-epileptic medications, they include the Depakote, that is basically the valproic acid. And then we have the Felbutol, that is the Felbamate. We have the Gabatril, that is usually the Thiagabine. Keppra is usually prescribed in a lot of individuals, that is basically the Levetiracetam. And then we have the Lamictal, Lamotrigine. Then we have the Dilantin, that is basically the phenytoin, that is the most typical drug that was used for the anti-epilepsies, or that is the most typical kind of drug used in the epilepsy or the epileptic medications. Neurontin is one of the drugs that is a newer drug. Gabapentin is used for the neurological diseases. The Lyrica, which is also the pregabalin, is sometimes prescribed in a lot of individuals. And then we have the phenobarbital, which is also prescribed in a lot of individuals. So these are the range or the different variants of the medications that are available for further use in the individuals who are suffering from the epilepsy. Now, when we move on to the tagritol, that is basically the carbamazepine, and then we have the trileptal, which is prescribed in a lot of individuals. So one has to keep in mind that all of these medications have their own side effects that have to be kept in mind when you are dealing with a patient. Obviously, one has to weigh the benefits, the risk versus the benefit ratio in a particular individual, and then prescribe these drugs accordingly. Topamax is sometimes prescribed, which is the topiramate. Then we have the zonegran, that is basically the zonisamide in a lot of individuals. So moving on to the surgical treatment, which is sometimes an indication in a lot of patients who are suffering from epilepsy. Sometimes we couple the surgical treatment with the medical interventions in a lot of patients. The factors influencing this decision, it is basically depending upon the fact that the ability to identify the focus of the seizures is again very important. Sometimes there is a tumor, or sometimes there is a focal lesion that can be treated through the surgeries, and in a lot of patients it has a very good prognosis. So if you have the more benefits of the surgery, then you can go and indicate surgery in these individuals. Obviously, there are these tumor boards that are available, and they have to decide whether surgery is indicated in these individuals or not. The area of the brain involved can be safely removed in a lot of individuals without resulting in the significant deficit. So the risks have to be calculated on other hand. When you're performing any intervention which requires opening up the brain is again very important, because you can damage a lot of structures that can result in a significant deficit in that individual. Other treatments have been unsuccessful. So you are basically resorting to the surgical treatment. So these are the different causes that can indicate surgery in a lot of individuals. Then on the other hand, we have the vagus nerve stimulation that is sometimes indicated in a lot of patients, an implanted device that sends regular mild electrical impulses to the brain via the vagus nerve. So it may also be activated by an external magnet, and sometimes the functioning of the vagus nerve stimulation is it is usually affected by the use of the TASER device that is inculcated or that is installed in a lot of individuals. So basically in this section we summarize the different treatment modalities or the different management guidelines that we have to keep in our mind when we have a patient of epilepsy at our hand. So that is the end of this section. Thank you for watching sqadia.com.